Hi, everyone. I'm Steve Kep, co-founder of From Day One, our forum on corporate values. Welcome to today's webinar. We're excited about this topic, looking at how employers can use employee engagement with benefits to determine a clear picture of overall well-being in their workforce. But before we get started, I want to share something special we have for today's attendees. One of our monthly virtual conferences is coming up on Wednesday, April 6th, and it's titled Managing the Human Impact of Digital Transformation. It's going to be particularly useful for employers who are breaking in new digital tools and need to pay close attention to the varied and influential effect of this change on employees. Thanks to our partners, including today's sponsor, we have some complimentary VIP tickets available for those who joined today's webinar, and that would be you. I'm putting a link in the chat space right now. You'll want to take advantage of this one since the regular price for our conference tickets is $149, and this link will give you a free VIP ticket for the whole day's activities. And now today we'll be exploring the topic benefits engagement, a tangible indicator of a happier and healthier workforce. At a time of increased burnout and mental health concerns, benefits engagement has become an indicator to employers of how their employees are coping. Research shows that employees who understand and make good use of health programs tend to be happier and healthier, and therefore more productive and engaged overall. So how can you help your employees navigate their health and wellness offerings? Other questions include, how can we foster better alignment between the C-suite and HR and benefits leaders looking for solutions that drive engagement with benefits? How do your benefits and total rewards offerings differentiate you as an employer in this current labor market? Our sponsor today is League, and I'll tell you a bit about them. Founded in 2014, League is a platform technology company powering the digital transformation of healthcare. Employers like Unilever, Uber, Shopify, and Lush Cosmetics use League's health operating system to deliver an integrated and personalized health benefits and well-being experience that employees use and love. This new front door to healthcare eliminates the current sea of point solutions via an ecosystem of over 100 insurance carriers, healthcare partners, and HRIS systems. Millions of people across the world use the League platform to access, navigate, and pay for care. Now, a few quick logistical items before we get started. This webinar is being recorded and will be available on demand soon after the event, so you can look out for an email in about 24 hours with a link. That email will also have info on how you can get professional development credits for the session from both the Society of Human Resource Management and the HR Certification Institute. And look out for a written account of the conversation on our website at fromdayone.co. Now, for you in the audience, about 45 minutes or so into the webinar, we'll have a Q&A session. You can submit your questions anytime you think of them using the Q&A button at the bottom of your screen. Now, I'd like to introduce our moderator for today, Emily McCrary Ruiz Esparza. Emily is a freelance reporter based in Richmond, Virginia, who writes about workplace culture and policies, hiring, diversity, equity, and inclusion, and issues faced by women in the workplace. Her work has appeared in the Washington Post, Fast Company, and Food Technology, among others, and has been syndicated by MSN and The Motley Fool. Okay, Emily, take it away.
Thank you so much, Steve. I appreciate it. Tim and Kim, I'm really happy to be here with both of you today. An hour sounds like a lot of time, but it's really not once we get into our discussion. So I'm going to go ahead and jump right in. I want to start by talking about sort of the state of things when it comes to health benefits and programs and how employers are using them. So with COVID and an increasing growing concern around mental health as a whole, what changes are the two of you seeing in employee behavior when it comes to accessing health and well-being programs? What are you seeing recently, and how exactly has that changed over the last 2 years? We'll start with Kim on this one.
Sure. So we know that most employees, like Steve said, don't understand their health benefits. Insurers are kind of hoping that employees don't understand their health benefits. And for years and years and years, we've just kind of let employees sit out there, not fully understanding what their insurance covers them for. Come COVID, suddenly everybody is very interested in their insurance and everybody is very interested in going out and accessing care. So with COVID, we've actually seen employees accessing their benefits more so than ever before. asking a lot more questions and becoming a lot more educated as consumers in benefits and their wellness healthcare coverages. What we also saw was employees were fully expecting support from employers during this time. And for my colleagues on the line who were CHROs or CPOs, we suddenly became epidemiologists overnight. We were suddenly the experts in PPE. We were the can I come into the office place to ask questions. Mental health was a huge challenge. And suddenly we found that HR was really inundated with questions medically that we couldn't answer. And we'd never been through this before. There was no playbook. And so what we actually did at League was we went out and we found support through the Cleveland Clinic, and we brought in medical support for us in order to ensure that the advice that we were giving to our employees and the policies and procedures that we were developing to help support them during this time were medically sound, or at least up to date with what we knew about this particular virus. I would say though that the door is open and it's going to be very difficult to close it again. So like I said up front is employees generally didn't understand their benefits until they were sick. And now that employees have actually accessed their benefits and really started asking a lot of questions because they were seeking a lot more support during this time, they have a very good understanding and they have become far more critical to what it is, the coverage level that they need for themselves and for their family.
And what are you seeing on your side when it comes to employees accessing their health and well-being benefits? And if you could place this in the context of what Penmac staffing does so that our audience can hear a little bit more about your company for context.
Yeah, I mean, we're really seeing an increase in a lot of areas as far as engagement with the benefits, and just from the standpoint of questions coming from people. I think the level of comfort over the last 2 years of our employees to actually engage and ask about their health benefits, as well as their mental well-being, has really increased a lot. So our approach has kind of targeted maybe more of a customized per employee type to kind of personalize the situation, maybe even hyper personalize it so that each employee understands what their benefits are. Because much like Kim said, a lot of our employees don't even know or didn't even know that telehealth was an option for them. So when they got ill or sick, they would run to urgent care. And in a lot of those instances, telehealth was a better option for them. So just engaging with them, helping them understand the proper way that they could utilize their benefits has been very important to what we've been doing.
Thanks. Could you tell us a little bit more about what Penmac staffing does, just for context for our audience?
Penmac staffing is a large staffing firm. We have a footprint at 36 locations across 10 states. So we mainly staff in manufacturing and distribution.
Great, thank you.
You're
So
welcome.
what are you guys seeing in what prevents employees generally from using and participating in their employer health programs? You've mentioned already just simple lack of awareness. Apart from that, what's keeping them from using these tools that are made available to them?
Well, I think a lot of it does go back to cost. If you look at the cost of health benefits over the last 10 years for us, they've almost doubled in cost. So really educating our employees on why they want to invest in their health in these different ways is important, because a lot of the people that we have may be really working hard to make ends meet. So understanding that concentrating on their wellness and that there's just more than just the health insurance is very important to leading them to a healthier well-being, which also leads to more productivity, which ultimately affects the bottom line.
And Emily, I'll add to that. And I'll say, health insurance, like Tim said, it's not only about when you're sick. When you're sick, it's already too late. You're already in that cost situation where you have to make critical decisions. It's about preventative health. And through a real wellness program, it's about helping employees to engage and stay healthier so that they could avoid those situations. COVID is a great example. And I think that the example that Tim gave about urgent care is so relevant to our current times. Whereas employees previously would have showed up to urgent care without thinking about it other than the cost, obviously. Now, employees don't want to show up in urgent care. Nobody wants to end up in a hospital because we know that hospitals right now are overburdened, as well as, the place where you're most likely to pick up COVID. And so, providing better benefits that are really about prevention, really about wellness, helping employees to really engage and think about their health every day in order to stay healthy, instead of thinking about benefits as an insurance coverage for when you get sick. And it really is a shift in the paradigm that employees are very open to right now.
So it's more about keeping things top of mind all the time, away from I'm sick right now. It's not acute care. It's ongoing. It's ongoing participation with benefits, it seems.
Absolutely. The right benefits programs are about engaging employees when they're well and engaging them in remaining well and in their wellness journey.
Let's talk about what you guys are doing in your own workforces and for your own staff. So to help your employees with their mental health, what are you doing? How are you helping them navigate and understand the benefits that you provide regarding health and wellness? And what have been the most successful programs that you've implemented? That was 3 questions in a row. So we'll start with the first one. The first is, what are you doing to support your employees' mental health and wellness?
Well, for us, it's really a shift. We're going from the approach of safeguarding lives and livelihoods to how do we actually make their lives better. And so with that approach, it comes down to, of course, we've added an employee assistance program, but it's more about communication. Rather than just hitting the high areas of benefits around open enrollment, we're really starting to engage more frequently. And the engagement that we're doing is really targeted towards what we feel like or what we're hearing from our employees on an ongoing basis or daily basis that they're interested in hearing about. So we're really trying to structure that around what makes sense. Like, for example, our wellness program. In the beginning, when we really started kicking it off, we had about 50% participation, but that was mainly because the majority of it was weighted towards fitness and steps and activity. And what we found is that was really the people who were already exercising were the 50% that were participating in the wellness program. So we had to restructure that and really start thinking about, well, what are the other things? Wellness checks. If you are feeling depressed, are you seeking help? What are the things that you can do? Though they don't share that information with us, but there's a lot of different things. Being involved in a community or a volunteer activity. There's a lot of things like that. So all of a sudden we shifted to where, yes, fitness is still very important and we want you to do everything you can, but that's only weighted at 30%. And then all the other wellness benefits that you do, they're weighted at 70%. So that allows us, like, they can focus on things that maybe are stress points for them, like childcare, or they can have opportunities to education about their finances. Our jobs, because we are in recruiting, of course, it's a tough time for us because finding people is really hard. And so the stress there is immediate. So we have to make sure that we're providing lots of education and lots of outlets for our employees to get the type of wellness that works for them.
I like the program that you mentioned and shifting that to really make sure it's what your employees need, what they respond to even. Have there been any other specific programs that you've piloted recently that you found to be really successful, maybe specific challenges or anything like that?
Yeah, we kind of talking about incentives a little bit, we actually, instead of doing the money thing, like, for example, I'll give you one that didn't work. For years, we've been trying to get people to stop smoking. And so one of the benefits is that if you're not a smoker, you're rewarded with slightly better premium. And And so in that 10 years time frame that we probably offer that benefit, we've had 0 people stop smoking. Money really was not a driver for them. Now turn the page, and we had an opportunity for people to get health risk assessments. And in that particular instance, we offered a free day off, a paid day off, okay? And our participation was great. So the raffles for gift cards and things like that, we're finding are not successful. But when you personalize it down to the level of the employee, we're really seeing success in those programs. So the health risk assessment thing worked really well.
I love that. And figuring out exactly what is motivating your staff, because that's getting down to the root of what they'll actually end up using is what do they want? What are they after? Whether or not it feels like it relates to the benefit of the program that you want to institute, right?
Yeah, and so it's not a one size fits all type approach. So we have to think of, we have these subsets of employees that are incentivized in different ways. And then you have to build what is it that you're truly trying to incentivize, and then build that incentive around that to really get the behavior modification that we're looking for.
Kim, what are you doing at League for your employees? How are you helping them navigate it? What are some new programs that have worked really well or not? Because I love Tim's example of what they saw didn't work and how they changed tack.
Sure. So first and foremost is we listen. And we have very formal ways of listening, and we have surveys and ongoing feedback and real two-way communication with employees. And what makes that particularly successful is that we action our surveys and we really directly back to the feedback. And so, especially over the course of the last 2 years with an ever-evolving situation, we've gone out to employees and we've said, what do you need? How can we help? Is this program working or is it not working? And because we're small enough and we're agile enough, we're able to really iterate, right? We are a pretty small business. We currently have about 500 employees across North America and internationally, but it's fairly easy for us to kind of say, okay, well, we used to give you dollars there. Instead, we're going to put a program in place, or a program that used to be an in-office program that now no longer makes sense because 30% of our employees don't ever come to an office. And currently none of our employees come to an office. It was about how do we translate that benefit into something that's meaningful today. So for example, we used to have a yoga instructor, we used to have massage therapists who used to come into the office. And these were ways in which, first of all, you came into the office and you knew you were at a wellness company. You kind of heard it and you felt it in the walls. And it was about really translating those programs into a way where every single employee who worked for League really understood that they worked for a wellness company and that we valued wellness. And so listening to how we could translate that individually at the individual level, just like Tim said, it had to be very personal. Things that we heard were, Zoom fatigue. I never see the start and end to my day. I don't really get to get my work done anymore. I can't go lock myself in a room. And so we implemented something called flow time, which is between 12 and 2 every single day, Monday to Friday, is no meetings. And that provides employees with an opportunity to get work done. Look, some employees have little kids at home. Some employees are taking care of pets or aging parents, and they've got a different circumstance in their home. And if they need to take time during their day to address personal needs or personal health needs, or even to go for a run, that's time that they can use that way and find the break. The intention really was about providing time to be able to get to the heads down work where everyone in the company was going to be doing the same thing. And the pressure of having to say no to meetings was taken off of them. Another thing that we found didn't work was we have unlimited vacation. And my biggest challenge is getting people to take vacation. We're a very, average age at League is quite young. It's in the 20s and very typical of a startup. And so there's a guilt associated with taking time away. And so what did we do? I want you to imagine unlimited vacation's not working, but we put in wellness days. So on a quarterly basis, everybody was eligible for wellness days. And suddenly people started thinking about what they needed. And suddenly we saw a huge uptake. 70% of all employees last year took some of their wellness days. That's huge for us. And that was the very first time that we implemented it. And the reason was there was a lot less planning associated with it. They didn't need to really think about who was going to cover their work. It wasn't about, kind of taking a whole week off or 10 days. It was really about waking up in the morning and saying, today's not the day. I'm not going to be able to be my best, and allowing employees to really activate on their own personal needs to be their best selves when they came into the office. So that was huge. And then another thing that we have done is we have focused on connection. And so we know that employees, and one of the things that, helps to differentiate us as an employer is this incredible culture and this focus on our values and a focus on our mission that really connects us. Really hard to do that when you're not seeing each other in real life. And so we've put together a number of connection groups. We've really revamped the way that we onboard people to ensure that there are connections made right from the very first day. Lots of councils, lots of feedback opportunities, and lots more engaging group events and reasons why employees are getting together. An example of the success of that is as we launched a mentorship program, and we have over 160 people currently matched with a mentor internally. So folks are craving connection, craving the counsel of other leaguers, and learning and meeting people from across the business who they might not see in real life for a little while until we kind of sort all of this out. So those have all been super, super new and very helpful to us in fostering connection and really ensuring and maintaining wellness amongst our employees.
The mentorship program, Kim, how structured is that? Is it similar to your PT or your wellness, where you're saying, hey, we want you to take advantage of this, so we want you to meet monthly or quarterly? How are you getting your employees to use that, or are they just so hungry to take advantage?
So it was actually driven by employees for employees, and it was actually focused on diversity. If you can imagine, that's where it came from. And so particularly in a tech environment where some organizations don't have great diversity, our diversity numbers are getting better and better. We currently have over 41% of our employees as identifying as from one of the racial groups across Canada and the United States. And so our diversity is very good. But what we heard is that mentorship for racially diverse people needs to be from and with racially diverse people. And so that's where it was initiated. But all leaguers have now taken opportunity to participate. And so it is structured in the sense that we have provided training about what it means to be a mentor, what it means to be a mentee. But we have really also allowed these connections to meet as frequently as they believe is necessary and as frequently as they think is beneficial. We do check-ins to make sure that it is a good use of everybody's time. And to be honest, we've had some matches that don't work, and they've come back to us and we've helped to facilitate alternative matches. Sometimes you want to work on a very specific skill, and so you're looking for someone from a very particular area of the business and might not know how to access them. And so that's how, the HR people and culture team is really helping to lead that way.
I know in my own experience in this space and reporting on this for many years, mentorship programs are so difficult for companies. I think we're just not kind of trying to figure out, or they're getting good at figuring out how, what you mentioned, this balance of some structure, but plenty of freedom to use that is a really strong direction to go in. So thank you for sharing that. You mentioned connection. Tim, I want to throw this next question to you because you serve a particularly distributed workforce. You mentioned, I think, 36 states in the US, which is very large. So how are you, how has your approach to benefits engagement changed in the last 2 years?
Well, I mean, again, communication is key. I mean, we have to, and it's not just communication, it's communication that's heard. Prior years, we would send out notifications and emails about benefits and open enrollment and everything. And while, ultimately the people who wanted to enrolled and others did not, we never really felt that we were connecting at the employee level. So the easiest way to do that, because we are so spread out, and so much like a work from home environment, we've kind of been that way because we've got 36 locations spread out that, really, they could have as many as 20 employees and as little as 2 employees at each location. It came down to having a digital platform that could be accessed by multiple types of devices. Not every one of our employees have a computer at home, but they have a smartphone in most cases. So being able to, at a glance, see what their benefits are has been huge for us. And then communicating with through that device and other ways of things that are benefits for them, and it really can be at any time of the day, at any time of the week that they can access that and get some answers to what they need. So that's really one of the most important things. And then just, we also provide healthcare benefits for our contingent associates, temporary employees from day one, and switching to a platform that actually gave us a digital opportunity for them as well, where they could really see some of the ways that they could take advantage of telemedicine, as well as how we could cut down the cost for them at urgent care centers. That's been huge too. So really, it goes back to communication. How well do we engage with them, and how well are we doing that at the employee level, rather than just a webinar that may or may not get attended. We're really trying to drive the attendance in the webinars, and we see participation, because they're more aware of their benefits, increase.
You mentioned making sure your employees know what's available to them from the start. I think making that part of the onboarding process is so important, not only to use, but to employee retention as well. Going in knowing that you're going to be equipped, rather than sitting through the first week of orientation or just getting to know your staff, maybe already feeling overwhelmed. If you have it in the back of your head, I do have all these resources available to me. I do have wellness days. Even if you don't need to take them right away, understanding what's available to you as an employee, I think gives you just such a smoother glide in, right, when you're coming into a new organization. So speaking of retention, I do want to talk a little bit about attraction as well. This is a really tight labor market. Everyone's competing for talent. Some skills are more in demand than others, but pretty much everyone in this market have more choice. So how do you design your benefits and your total rewards offerings to differentiate you as an employer and to compete with maybe your direct competitors, anyone else vying for your ideal candidates? So how are you using those packages?
Well, first and foremost, we're a 100% employee stock ownership plan. So that's one of our huge benefits from the get-go, is helping employees understand that, they can become an owner of the company. So that's it, the biggest piece. But as far as structuring benefits around that, we've really looked at how can we help with the cost compared to other employers of our size, not counting our temporary employee associates. We actually pay a larger portion of the healthcare piece of it. And then for those employees that look at possibly going the high deductible route, we actually, to help them with their health savings account, we actually will make deposits into that for them on a monthly basis, so that helps them with some of their minor medical expenses as well. So those are some of the big things that we do. But, as far as what we're seeing with clients, I mean, everything from unlimited vacation plans to 100% paid health benefits to 100% paid health benefits for family. I think because it's so competitive, it's so fluid right now that it's almost like wages. Wages are appreciating at a level that we haven't seen, that it can become a keeping up with the Joneses type approach. And we have to be real careful that we're actually providing things that our employees want. And that's what we're looking at.
Kim, what about you at League? How are you using your packages to attract new talent?
So we believe that benefits is a key differentiator in the market, obviously, and it is the tightest labor market, like you said, in modern times. And so we believe that your benefits are really a representative of who you are and a great way to demonstrate to employees and to potential employees what it is that you value. And so we champion families, and we have really generous parental leave. We champion families, and we provide very generous fertility benefits, which is very attractive to people identify as women or men who are thinking about starting a family at a certain, time in their life. We champion diversity and belonging, and we put our money where our mouth is, and we have transgender benefits, which is leading in the marketplace. And so those are just 3 examples of how we've leveraged our benefits as a way to really help potential employees understand who we are and what we value at League. And so if I am somebody who is thinking of starting a family, if I am somebody from the LGBTQ plus community, if I am somebody who is afraid that, whatever it is that my particular family situation isn't going to be a match, and I'm not going to feel like I belong in this organization, we are telling people off the bat, just through our benefits, that is not who we are, that we are very open. We believe in diversity, equity, and inclusion, and that we really will provide support to all different types of employees. And that's really powerful. But we also believe that it's not only about benefits, it's also about some of the perks. And so just as an example, and things that don't cost very much money, throughout COVID, really thinking about what the individual person needed. While we closed the offices, and of course, in order to maintain safety of all of our employees, nobody was required to come into the office. We had some employees tell us that they don't have appropriate space to work at home. They were living in very small apartments, or they actually had a difficult situation with whoever it is that they were living, or didn't have an appropriate workspace. And so we had 1 to 2 employees show up every single day, the entire pandemic, to provide them with a healthy and safe place to work in our office. Similarly, we have employees across the country now who are craving connection. And so we've provided WeWork passes and encourage them to get together where it's safe and when it is safe to do so, to get together and to collaborate, because they are most effective in team environments. And so really thinking about your benefits, but also thinking about what they say about you. We are an organization who believes in collaboration. We are an organization who wants to be able to provide, a safe and rewarding experience for employees at the employee individual level, and our benefits tell that story.
So with COVID and today's market, both of which you just mentioned, we're seeing a rise in the pivotal role that HR is playing. HR staff are doing more than they have ever done before, ever, as I'm sure both of you know. HR is worried about the mental health and connection of their employees, but productivity is still top of mind for the C-suite, right? They're still looking at the bottom line. It's not always a conflict of interest, though it feels that way, it certainly can. How can we foster better alignment between the C-suite and the HR and benefits leaders looking for solutions that drive engagement with benefits? So how are you working with your C-suites to make sure that you are on the same page about this kind of thing and reaching for the same thing? Kim, we'll go right back to you on this one.
Yeah, so there's an ROI. And it's a clear ROI that HR leaders can be speaking to the C-suite about and to their CEOs about. And so when we talk about the costs associated with benefits relative to the costs associated with absenteeism, but more importantly, presenteeism, which is, the new language of what we're thinking about. And so if I'm an employee and I have a 2-year-old at home and my daycare center is closed and my partner works shifts, how am I supposed to be productive and present in my Zoom call? And while lots of organizations said, we don't mind seeing your fur babies, bring your kids to work, The truth is it's very difficult to be 100% productive when you don't have the supports that you need. And it is incumbent upon employers to be providing appropriate benefits and appropriate perks to allow their employees to be fully productive and fully present. And it pays off in spades. It pays off in the amount of days that people take off of work. It pays off in the amount of time that they are at work and they're able to be fully productive.
Tim, what about you? What are you doing at Penmac to make sure that the C-suite is aligned with what you're doing and the goals that you need to achieve?
Well, I mean, being part of the C-suite, you know, we really want to work with the HR team and the benefits team on, you know, really having a full understanding of what we all agree are our objectives and key results, and how we get to there. And I think that having that clear objective, knowing what steps need to be taken, and then really sitting down and hashing out a strategy to work through that to make sure that we're meeting those goals. We're not blind to the fact that the healthier and the better the well-being is of our employees, the more productive that they're going to be. And that ultimately rings the cash register, so to speak, and hits the bottom line. So we want to do everything. But also, I think that we've had to develop a stronger level of empathy with the employee base that maybe we didn't have prior to 2 years ago. And honestly, I think that allows us to resonate with the employees that, hey, you know, Penmac is an employer that's not just, you know, a place to go to work, but has a level of care about your work-life balance, but also your well-being. So we really, when we work with human resources and everything, we want to know what proposed benefits are going to really hit the things that we want to accomplish with our employees.
As a reminder to our audience, we'll take a little bit of time at the end to address any questions that you have for Tim and Kim. Feel free to put those in the Q&A, and we'll get to as many of those as we can at the end of our time together. So feel free to keep putting those in the chat. Thank you to those who have already posed questions. We'll keep going for now. So what are any other steps that you've taken to better engage your employees that maybe you haven't mentioned so far? But more importantly, what have you learned in this process while trying to improve the engagement with health and well-being benefits? You've already both of you have already mentioned some things that didn't work. Sometimes those are the most important things to know, what didn't work. So any successes or failures there. So what other steps are you taking, and what have you learned along the way?
So I would say, I mean, obviously one size fits none is something that I think both Tim and I did discuss, and really understanding that benefits and wellness is very unique to the person. But also something that Tim said that I would like to talk more about is the idea that we now, you know, on our Zoom screens, we see your family, we see your kitchen, we see your bedroom, we see your messy bed, we see whatever the case may be. And the point is we can't unsee it. So for years and years and years, we tried to pretend that when somebody walked into the office door, that there was nothing behind them. Employees were expected to show up to work unburdened by their family troubles, unburdened by their children troubles, unburdened by whatever their financial troubles. And during COVID and over the course of the last several years, where we have had an intimate view of the insides of people's homes and the insides of their families, I believe that we are now responsible to ensure that the level of care that we have provided during this trying time continues. Because we can never go back and pretend that Susie shows up to the office every day and we forget that she had 3 kids hanging off of her during COVID, or a puppy that was sick, et cetera, et cetera. And so in many ways, some of these new perks that we have put into place to help to support employees, I would say, are going to be very difficult for anybody who wants to pull them back now. They've now become an expectation and, quite frankly, a responsibility of employers, of the best employers, of the employers who want to differentiate themselves. We can't now suddenly just care about our employees. We really have taken a position in their lives and in their families.
I think that that's certainly I think you made such a good point about we can't unsee what we know now. We can't ignore it. And I think something that the labor force is demanding is that the employer not takes responsibility for what's happening in our homes. That's our own, but takes responsibility for their role and maybe adding to the stress or complicating our lives, just understanding that they're just one of many components of a human being. And while that's always been true, employers are now required to understand that and required to behave accordingly. And that's good for everybody. That's even good for the leadership and the company, for both the company itself and the bottom line, but also their own jobs as well. They're now being required and forced to take advantage of benefits and take wellness days and take time off, because unless they're doing it, their workforces won't. And so they have to be setting the example. So too bad we all have to take time off now. Okay. So, Tim, what about you? And what you've learned?
Well, I could not agree with her more about what she was saying with the employees. Also, one of the things that we're finding that is important is that with each person that we're looking to attract. So let's talk about two things. One is talent attraction and the competition, which we touched on briefly. But for the last couple of years, the situation has changed. It's no longer the employee on the stage. And some employers are slow to get that, and some employees get it. It's more the company's on stage, and it's the employee wants to know, well, what is the work that I'm doing and how does that impact the world around me to make it a better place? But what is just as important is, what is the company doing for the employees that work for them that's making their job and possibly their lives better? And we really have to take time and understand what that is. I'm not saying we know all that. It morphs on a daily basis. But as companies are looking from a recruiting standpoint to attract the best talent and everything, it's something that they're going to have to figure out. And that is, how do they show that not only is the work that you're doing going to be meaningful, but you as an individual are going to be meaningful to the company? And that's something that we're really trying to work on.
I love that. So before we go into some Q&A, curious to know how you all are applying this in your own lives. About ready to talk the walk right now. So how are you personally keeping up with your overall health and well-being? How are you setting the standard for your own teams? And like I mentioned before, setting an example to make sure that your teams can know that they can use that. So how are you doing in your own lives?
Well, for me, it's struggle. I mean, as far as things go, it's time constraints, it's things like that. But ultimately, if I'm driving this from the top down of, we want you to be have a better well-being, we want you to consider your fitness, then they need to see that I'm making those type of changes as well. So one of the things in the one of the wellness apps that we use, it actually, you can share things that you're doing, and employees can see your points totals. So even though maybe I'm not as regimented as I should be on the fitness side, they can see that I'm gaining points for things like getting health checkups and getting regular things taken care of that I should be, and that I'm volunteering for events. There's different ways that you can get points. So ultimately, still working on the fitness side, and they can see that as well. But them having, whether they're in South Hill, Virginia, or Brainerd, Minnesota, they have an understanding that everybody from the C-suite is trying to not only preach the lesson, but also learn from the lesson themselves.
Kim, what about you? What are you up to?
Well, I have almost a 600-day streak on my Peloton. So, and our team actually works out together. And so in the summer, some of us are in colder weather conditions. And so in the summer in particular, we've all started running and going out, like literally ending a meeting and saying, okay, now everybody go get laced up. We're going for a run. Take a picture of your before, take a picture of your after, and take a picture of something that you saw along the way. And we do that within our own team. And we really do focus on, at the end of a tough day, I disconnect and everybody knows I'm going to go do something physical and then I could come back and be refreshed. And if I need to come back at the end of that day, it's going to be a more beneficial conversation, or I'm going to have better thinking if I've had that break. And so I encourage my teams to do the same things. We also implemented check-ins. I mean, it sounds so obvious, but asking people how you are, how are you? Oh, I'm fine. No, but how are you really? And so we spend time every single week as a team with the how are you really? And nobody gets away from that. We don't talk about business on those check-ins. We talk about personal. We connect. We're there to support each other. We provide each other with a safe space to bring anything that we want to talk about, whether they're successes or if they're things that are more challenging in our lives. But we do talk about things, everyone, whatever it is, to whatever level you're comfortable, whether it's what you did on the weekend or something that you're dealing with in your personal life that you just wanted some support from peers on. I've encouraged my team to take vacation, and I am measuring and monitoring that very, very closely. Our days are longer than they used to be, and it just feels more intense. And I insist, there's one rule: when you are on vacation, you disconnect. If you don't disconnect and you continue to be on Slack, then as far as I'm concerned, you're not on vacation and you should be answering on a regular basis. So, there's no middle ground. It's either you're on or you're off. And when you're off, I want you to be off because you need the time away and you need to refresh. And so those are just some of the things that we're doing, at League and within my own smaller team to really help encourage each other. We've included meditation into our weekly town halls. We've included yoga stretches into, weekly meetings. And so for us, bringing some level of fitness or some level of breathing exercise or meditation has really been helpful. Although I do have one person on my team who loves to take photographs when other people are meditating, and that's annoying, but it's almost become an internal joke on our team.
Sure, it looks like everybody's just sleeping on a
terrible. You've got a picture of yourself like
what you mentioned about being out of the office and truly being out of the office. That's something in current workplace culture I'm so glad to see die. Of answering emails on vacation. We never should have been doing that, but in my working career, that was always required. That was always expected. And to be honest, it wasn't until I became independently employed that I actually said, you know what, I'm just not doing it. But I never had an employer really okay that. I would never go back now. I would never work for someone else who does that. It's just such an important and valuable, that's my time. I will be taking it. So I love the idea of just really not even allowing a middle ground. We have a lot of really good Q&A that I would like to go to. Thanks to everybody who's popping your questions in there. Feel free to keep going. We're going to get to as many as we can. The first one that I'd like to begin with is about deferred care. So for anyone on the call who's not familiar with the term, during the pandemic, people weren't comfortable going for their regular wellness checks, be it just their health check, their OBGYN appointment, their eye check for the year. People were deferring that because of health concerns of going into the office. Maybe they couldn't even get an appointment. And now they're maybe starting to schedule those again. What happens is that you end up encountering more problems, maybe more health problems than you would have if you were getting regular preventative care. So during the pandemic, many workers were doing this. Are you trying to engage them about that problem? Are you making them aware? Are you trying to get them to go back in and get regular preventative checks? Tim or Kim, either one of you working on this?
So I would say we were very intentional about this throughout the pandemic, and even things like getting vaccines. We really wanted to encourage our employees to do that, and therefore we provided them with a day off to go get vaccinated, and then we provided them with a day off if they needed to take their family to go get vaccinated. And so the constant, intentional discussion about maintaining your own health. If people did get sick, or if people did, have COVID, then it was really about ensuring that they were getting the care that they needed. And I understand we're talking about preventative, but I just believe that we've created an intentional environment of focus on our own care and our own self-care that really helps to make it a very conducive environment to ensuring that employees know that they're fully supported in ensuring that those appointments are back on track and that they have the time and the support to go and do that.
For us, yeah, I'd mentioned that we use an app for activities. That app's called Vigor Room or Vigor Room. And one of the great things about that wellness app and the point system is that getting things like a colonoscopy or whatever, if that's something that you have to have, or different things like that, add to your points. And so when they're engaged with the app, they can see all the different things that maybe they've neglected and be able to say, you know what, I do need to schedule a mammogram or whatever it may be. Let's get that done. And then I get the points for it. So, it's been real important for us, or we've really seen by having this gamification aspect to it and making it fun, that people grasp onto it a little bit more than us sending out a email blast or a webinar. And I think that we're seeing people come back to it a little better by using that particular application.
There's nothing quite as satisfying as just being able to check something off a list. So kind of seeing it that way, that would really work for me, is rather than, okay, yeah, I see your email blast, I should go schedule my appointment. If I get to click a box and say, I have done it,
right,
instant endorphins for me.
Yeah.
So this question is from Mallory. What would you suggest for a nonprofit who maybe does not have the budget for all the bells and whistles of a great benefit system? I think this is applicable for even for-profit companies. Maybe you're just smaller. Maybe you can't build the size of benefits programs that you guys are able to do. What should they start with? What should be the foundations of a good program that supports engagement in this way?
I mean, I would say that communication is free. And so just better understanding what the needs of employees are. And I think that we would all be surprised to hear that what they really need is probably a lot less than what most of them are offered at any given point. And so, instead of going out and buying a one size fits none benefits package, really providing specific, even if it's about budgeted dollars, so that employees can go and use them when they need them and how they need them. And they would probably, for a much lower cost, get a lot more impact and value to be able to, and I use the example of when you have eyeglass coverage and you don't have eyeglasses, you really don't value it, but your employer is still paying for it. Versus if they would have given you a couple $100s and said, whether it's eyeglass coverage, whether it's fertility this year that you need, whether it's that you need some extra exams or extra blood tests, you can take those dollars and you can actually use them in a way that makes the most sense to you. And that way you can also mitigate and manage the costs as a company or as a not-for-profit. So it's just one way. Other ways, like I said, is it's about connecting employees, making sure that managers are well trained to be doing ongoing conversations, understanding what the needs of their employees are, and encouraging them to take the time that they need to access the resources that they need to have as well. Other things that I know Tim talked about was like an EAP program, very, very low cost, provides a ton of opportunities for employees to have access to different services when they need them. But in general, just not a very high cost program. Tim, what else would you recommend?
Well, thinking of, we have a nonprofit here called Life 360, and there's just not a lot of employees that work inside of it. So they don't really offer a full-blown hospitalization care. But one of the things that they've done to attract and keep the employees that they have is really kind of a knowledge base center that they put together. So you need dental care. Well, here's what we recommend, and here's some programs that can assist you with possibly the cost or finding a provider, and just having that knowledge. There are some other outlets that places, whether they're non-for-profit or for-profit, that they can look at. Consortiums are another approach you can look at, where you're pulling together several companies. Professional employer organizations are another thing that you can look at that actually help you, because they pull together many companies and are able to purchase the benefits at a much more affordable cost than, say, a company that has 5 employees. So there are some outlets to do that. But if that's not something you're willing to do, definitely I would say that you need to try to provide as much as you can provide, and look at the low cost things like the EAP, as well as just becoming an information center for those employees, to where they can get assistance on some expenses maybe that are not covered by any plan.
A viewer, Mackenzie, asks, this is specifically for Tim, but I'd like to hear answers from both of you. You mentioned hyper-personalization before. Kim, you a little bit touched on this, and letting employees direct that benefit. So whether they need eye care or whether they need it somewhere else, letting them personalize it that way. Mackenzie asks, does that look like new hire consultations with someone from HR, monthly webinars to share info with all the employees? She's just looking for insight here. They provide lots of written documentation, this person says, about their benefits options, but she's finding that, or they are finding that associates are not really referencing that. So they're just, I think, looking for ways to communicate this better, the option for hyper-personalization. Any ideas you guys have there would be great.
Well, anything that you can take digital, you need to. We just see a greater benefit out of that, where they have all of that information in that 4-inch screen that they look at every day. And you'll find that employees will explore that more fully than they will going to, say, a SharePoint on a shared drive with written documents. We've never had success with that, so I would agree with Mackenzie. But all of the things that she mentioned, whether it's even in the stage of recruiting, we're talking about benefits and things. And then, of course, when they're hired and going through orientation, and then we've really tried to be strategic about making them aware of things, having volunteer type webinars on benefits that they can join, making sure they understand what the content is, so that if it does relate to them, if they do wear glasses and it's on vision, that they can attend. But then also making sure that everybody has a full understanding of how the benefits have changed year over year and what the new offerings are. But having that in a format where a lot of self-research can be done is very critical for us as an organization, to personalize it to that person, because they can look at that platform, jump on there, go to what they want, and find out the information that they need. And so that's probably one of the biggest ways that we personalize it, or hyper-personalize it.
Kim?
And the name of that platform is League. So, and all joking aside, so the League product actually is on the phones of employees, and all of that information is at their fingertips. And when they cannot find it, there is a live agent at the other side of the computer screen who can actually provide them with the information on their particular coverage, their particular benefit. Also makes, going through the process of submitting benefits very, very easy, and making choices very, very easy. And so not here to do an ad for League, but certainly, the way that Tim is describing it, he of course is a customer, and the way he's describing is actually describing our app. So we have facilitated, and we've actually rolled that out obviously to all of our employees as well. And so that is the best way I know how.
All right, so we're at the end of our time. I want to thank Kim and Tim, both of you, very much for taking the time to share your knowledge with everybody. Very much appreciate your thoughtful answers and contributions. I'm going to kick it back over to Steve from Day One.
Thank you.
Thank you indeed, Emily, Kim, and Tim, for a really thoughtful, candid, and at times folksy conversation. You all reminded me to confirm our family Zoom yoga class for tonight. So thanks again to our sponsor League and to all of you in the audience for participating today with some great questions. If you'd like to join us for more virtual events, you can head to our website at fromday1.co and check out more of our upcoming webinars. I will mention 3 of them before we close. This Thursday, March 3rd, we'll be talking about how to build and maintain employee well-being at scale. Next Tuesday, March 8th, our topic will be improving the talent pipeline from end to end. Next Wednesday, March 9th is our monthly conference, which will be about enhancing total rewards to fit the workforce's new expectations. On behalf of everyone at From Day One, thanks to you all and stay well. Bye for now.